Today I'll be talking about failures rather than successes, because all of us think that whoever else is doing well in life or running or whatever are just having a gaga time, and how phenomenal it is for them, the whole life, how phenomenal it is for them. All right. Now for me, it's been a roller coaster of a ride. I started running some 34 years ago, and by the time of 16, I was running a half marathon every morning, kind of thing, very happily without getting hurt. I was pure lucky. All right. It wasn't about my planning was right, because there was no plan to it. Okay. I would run for 2 hours every morning as fast as I could. I was pure lucky. All right. Very important to understand that part. My friends were falling apart. They were getting injuries left, right, and center. So it started from there, that whole journey of how fast can you run, how long can you run. Yes, as a 17, I'd done a full marathon in 2 hours 38 minutes. Point really is, I was lucky. Yes, I used to love running fast, but I was pure lucky. Yes, I did some strength training, but barely. Okay, so that's where I got started with. When I was doing, funny enough, when I was doing my sports medicine in Nottingham, I picked up running again after like not having done too much for a bit, because in UK running scene is very big, and universities and all that. And within like a day or two, I had very bad shin pains, and I discussed that with my professors who were teaching us how to deal with sports medicine injuries. The theory part was okay, but the point was, when it came to the practical of actually getting me walking and running again pain-free, it wasn't doing good. Okay, so for 2 months, 3 months, I was struggling. It was very painful. All right, very severe shin pain while doing sports medicine, for God's sake. All right, so that was my introduction to how bad injuries can be in a sportsman's career, and how bad can it affect you, because to me, running was love, my love, first love, and I couldn't walk, forget about running. All right, so that was my first introduction to how bad can an injury be and how can it mentally mess you up. So when I get a patient who says, oh, but you don't understand how important running is, come on, I know what running is, all right, to you. But sometimes what is important is to step back and look at the bigger picture. How can you do it for far longer rather than just one more race? Okay. Then while I was in London, introduced to friends who were running ultras by then and all that. So that was my introduction in 2004 to ultra marathons. I'd signed up for something called Paris to London. And I'm not trying to tell you how amazing the whole route was or how amazing I was. But the point is, it was supposed to be Paris Marathon, the route between Paris to London, and then London Marathon. So it was 8 marathons or more in 8 consecutive days. Right? Back then it used to be a big deal. Now everyone can do everything. But the point is, back then, no, not many people could do that even abroad. Anyways, after 4 days, I had a severe injury on the left side. Forget about the details, but the point was I could not even walk. I came back, and then obviously couldn't even do the London Marathon. Now the story is not so much about that, but it is about, I used to struggle to cross the street. Okay, when I would see a car 100 meters away, I had to really think, I had to really plan now, should I put my first leg, left or the right leg down on the road or the street to cross, because I did not have the confidence to cross the road. My confidence had gone for a toss. This was a guy who was planning to run from Paris to London, all right? So that's how it shakes you up when these injuries happen. So as much as you love your running, when these injuries happen, they shake you up, all right? Then I've had a couple of disc bulges in the lower back, upper back, all that. My left leg is far weaker than the right. And what happens is, my leg doesn't move enough, my left one versus right. And I still love running long. Now that's been a big issue, because for that, what I've needed to do is work very hard with my left side, appreciating the fact that sometimes strength takes a lot longer, your numbness doesn't go, your weakness is going to be there, and you need to just keep working on it. To get back to running, because you need 2 legs and 1 leg at a time, you have to have almost equal strength in left versus right. So it's been a struggle with that. It does not happen overnight. And this is coming from a guy, who puts all those races together like La Ultra and the rest of them, right? So effectively, it is very important. You have to work with them, and sometimes mess ups happen. Like this year, there was a friend who was wanting me to pace her for a full marathon, for a sub 4 hour full marathon, which shouldn't have been a big deal. I had to stop after half a marathon, because I had severe knee pain on the outside, because what was happening was, as I said, my left side is weaker. I'd not been training enough. I'd not been running those distances. and there was severe pain. I couldn't even tell her because she's a patient slash a friend, and I couldn't tell her, hey, listen, my leg is gone. But anyways, I had to give up. And I have had a lot of DNFs in races. Now, people would talk about silly t-shirts they wear, where death before DNF. You know what? Let's talk when the death is around the corner, and then talk about, do you want a death before DNF? Because those are silly statements, all right? Point is, longevity of running is very important. Longevity of whatever sports you do, or you just stay fit and you live, you run a company or whatever. That's very, very important. Physical activity, going to the gym, that bit is very important. You need to fix, sometimes you need to step back. You step back, you're looking at the bigger picture in a more mature way. Another challenge I have is, and I've had to deal with it myself, hey, I want to be doing things as I was doing as a 17-year-old. You're not a 17-year-old, right? Your recovery was far quicker. You could run far faster. Do not try to be what you were as a 17. Don't do that, because most injuries will come along then, all right? Think of yourself the best you can be today, because most of us are not even doing that, all right? So that psychological bit for an injury is very important. You need to understand that, okay? It was a few years ago. I had fever and a lot of weakness, and I went to the loo and I collapsed. I did not know what had happened, but I was on the floor and I did not know suddenly where I was. And I was scared like no one's business, all right? So this year again, after we came back after the 9th edition of La Ultra, randomly got fever and flu and whatever, cold and cough and rest of it. And again, same type of weakness. And I was scared to go to the bathroom because I could have collapsed any moment, and I was very, very scared of it. So it's very funny what kind of fears you can develop out of the blue, no rhyme or reason, all right? And you need to keep working on it. As it was a few years ago when I had the fever and I would be scared to drive to go for my runs, I'm actually going through the same thing right now. Scared to get up in the morning, scared to actually go driving. Of course I have to, and I need to. But the point is, these kind of fears stay with us randomly, with any of us, for any amount of time. What I'm really getting into is, baby steps are very important. Don't try to be the way you were 10 years ago, a year ago, all that. Where you are is important to realize that and work on it gradually, slowly, keep building on it. Strength training becomes very important. Your running, whether you're gym, whatever, go back to your baby steps, keep building on them. It will take you a while, month, 2 months, to suddenly hit where your right level is, and you'll know when you do that, all right? And then you can, by leaps and bounds, start improving. But till then, go back to the foundation yet again, all right? And this whole thing about, oh, but others don't get hurt and only I do, that this one set is this, the other set is injuries will never happen to us. Both are totally wrong. You're like totally amazingly good and all that stuff till the injuries happen, and when they do, you'll be like, oh my god, now I get hurt all the time. So please be prepared for them. Injuries are bound to happen to all of us, okay? It's about how we deal with them, and remember, baby steps, gradually we are going to get back at it, okay? Like one very simple thing is, you're born, you're going to die, okay? You run, you're going to get hurt, all right? Deal with it in a more mature way, all right? And you'll be fine. And that's about it, really. But point really is, learn from those mistakes that you've made, learn from those injuries, learn from those failures. And if you don't, that's an issue, all right? And I'm sharing mine because I've really had a lot of them, okay? A lot more than I've just said, okay? So happy running, and if you gym, go for your gym, and that's it.